Doctors, what's an awkward moment with female clients? We are taught to explain to patients exactly what we are doing, as we are doing it. Delicate wording becomes important during female pelvic exams. Instead of "okay, I'm going to place the speculum inside now, so you'll just feel some warm pressure," my buddy ended up saying, "Okay, I'm coming inside you now." The female patient responds, "No thanks, I already have 3 children. So I'm a little bit late, but I have something. I'm not a doctor, but a pharmacy technician. About a year ago, a young woman comes in very upset and turns in a prescription for a bunch of anti-anxiety and anti-psychosis medications. All is going well, until I realize we are out of one of them, and I have to tell her I have to order it for the next day. She was okay with it at first, but then I see tears building. I ask if she is okay and says yes, so I continue typing up the prescriptions. I want to say there was about 8 or 9. Next thing I know, she begins crying. She starts telling me that she was just released from a psych ward and she had tried to kill herself a couple weeks back. She rolled up her sleeves and her arms were covered in deep cuts. She began to ask me if I thought she would ever get reaccepted to nursing school, because apparently they kick you out after getting admitted to a hospital for psychological symptoms. I had no idea what to tell her, except that I hoped she got in and that, if she worked hard, they should give her a chance. I know this all may sound shallow, but I was not prepared for this. Nothing in pharmacy tech training told me how to react, so this was definitely my most awkward moment with the opposite sex. 3rd year of medical school on my family medicine rotation, which I'm doing on my med school's campus academic health center. Electronic medical record shows 24-year-old with chief complaint of cough, so I go in to interview her. Where it comes to light, she's really there for vaginal itching. Finish up the interview and tell her I'm going to grab my attending for the pelvic exam. My attending tells me she'll let me do the pelvic if the patient consents. I had already done obs/gyn at this point and was quite comfortable with it, but we both agree I'd likely get asked to leave the room altogether. Lo and behold, patient consents. I do the pelvic, we write her a script for some antifungals, and she goes home. 2 days later, I'm teaching a small group of first year students how to perform an abdominal physical exam. Teaching is a requirement of the family medicine rotation, when, during introductions, I come face to face with my patient who never mentioned she was a first year student. We both play it off really cool at first, but during the session, her partner asks me to show him how to do an inguinal/femoral hernia examination on a female patient, aka his partner. While I'm doing my exam, she breaks out in hysterical laughter, which causes me to lose it and start laughing at the absurdity of the situation as well. She played it off like she was ticklish, and I said something stupid like I thought of something funny, don't mind me. 2 weeks later, she returns to the clinic for a follow-up, and I go see her. We talk for a while about how she's feeling, how awkward our second meeting was, and then just shoot the shit for a bit. When she goes, "So when are you going to take me out to dinner?" I politely declined and explained I had a girlfriend at the time and never saw her again. Working in ED at a large hospital without any pediatrics or obs/gyn. Just about to finish night shift when I'm asked by a nurse to quickly see an 18-year-old with abdominal pain. I was exhausted and didn't want to pick up another patient, but I just had a weird feeling. Went to see the patient. She was a thin girl lying in bed under the covers in the fetal position with her worried mum sitting nearby. I ran through a brief history and was about to examine when she stated she needed to go to the toilet. She looked to be in a lot of pain, so I asked for a nurse to escort her. At this point, the patient, her mum and myself thought it was a burst appendix. Next thing I know, the nurse yanks me down the corridor and shoves me into the bathroom. Before me stands a thin 18-year-old girl bearing down in a squat with a now noticeable baby bump repeating, "Don't tell mum, don't tell mum, don't tell mum." I throw her in a nearby bed and charge into the resus area, leaving the mum unbeknownst in her cubicle. I grab my boss, who goes white and starts shouting, "Why is she here? Why is she here? And not the obstetric hospital?" We run back in, by which time she is fully dilated and pushing. We successfully deliver a beautiful baby boy while constantly freaking out about the lack of pediatric supplies. We didn't even have clips for umbilical cords, but we improvised. Throughout this time the girl is either pushing or begging us not to tell her mum, while we keep saying, "She drove you here. You can't hide a goddamn baby." The girl wanted to keep the baby and ultimately we convinced her to tell her mum. I told the mum her daughter was safe, but there was something I needed to show her. The look when I brought mum into the resus room was unlike anything I have ever seen. Anger mixed with concern, mixed with joy, mixed with confusion. What a crazy freaking day that was. Being a resident in Saudi Arabia, there are huge stigma attached to male attendings examining female patients, especially those with gynecological issues. Also, being a foreigner residing here, some customs and practices catch me completely off guard at times. That being said, I was once in charge of my consultant's OPD during a Robgyn rotation. Said consultant having left early thinking all major cases and appointments had been dealt with and left me to clean up any stragglers in the last hour. In walks a 40-ish-year-old mother with her 18-year-old daughter, both completely covered from head to toe in burqas, who then proceeds to throw a tantrum about how the consultant wasn't there for her appointment and how she left a male resident in charge of the OPD. A cursory examination of the daughter's file didn't reveal any history, which would have helped me decide if my superior should get involved. I then began to try to talk her down, asking her what her appointment was about and how I was in charge of the department. I didn't dare reveal I was just a lowly resident and I would do everything in my power to help her out with any issues her daughter had been having. After a lengthy conversation I find out that the daughter was there for virginity verification because she was to be engaged and subsequently married off that month, and appointments in my hospital's OPD are a bitch to get, and they needed to present that certificate along with some others regarding finances, genealogy and a few others to the prospective groom during the engagement ceremony. I went completely numb, detached, examined the poor girl silently. She was in the stirrups naked from the waist down and burqa above that, not even an islet, and discovered, for the first time, a stack of thick, extremely official looking certificates in a desk drawer to be given to women who pass the examination. I have since performed that examination close to 30 times and have seen quite a few females who didn't have an intact hymen and actually sobbed quietly in shame during the examination. I try to explain to the family that hymen rupture is in no way a sign of promiscuity or even sexual penetration. To those people I know wouldn't understand, I just certify their duugtas virginities and tell the girl to come up with an excuse later on to their families. Damn, someone tells on me and I'm gonna be facing one hell of a malpractice suit. I had one patient who had made her desire for me very public, but since I treated her entire family, I decided not to kick her out and continue to remain professional. In the midst of a bipilomania, she kept complaining of female issues. During her pelvic exam, I happened to look up and I saw a gigantic smile on her face. After the exam, in the hallway in front of a few residents, she said, "If you weren't my doctor, I'd freak your brains out." Perhaps I should have mentioned this earlier, but she was the only woman I've ever met who is a 0/10. She's the only patient who made me question my heterosexuality. Technically I was a medical student at the time, but I guess it still applies. While on my psych rotation, me and my resident were called to the ER for a consult. Upon arriving we saw a slightly disheveled black lady with a crazy look in her eyes that was complaining about lower abdominal pain. The ER resident started to do a pelvic exam and suddenly backs away with a strange look on his face. The lady looks down at her crotch, says "oh that," and proceeds to reach into her vagina and pulls out an 8-inch tightly packed ball of wet paper towels. MFW, she reaches across to me and the psych resident and says, "Here, I was keeping this for you. None of us to this day have ever forgotten it." Long, but worth the read, and I am a real doctor. I was a senior resident supervising 2 interns on an overpass shift. For reasons that are beyond me, I got a call at 2 AM from the psych ward about a female patient with a bowel impaction that apparently could not wait until the morning. For the non-medical, a fecal impaction is a solid, immobile bulk of human feces that can develop in the rectum as a result of chronic constipation. Instinctively, I told one of the interns to head over there right away. However, he poo-pooed the suggestion, so to speak. I offered him a deal. If he did all the write-up and orders for the next 2 patients, I would take care of the bowel impaction. I thought he would at least take some time to weigh out his options or try to renegotiate, but there was zero hesitation. Realizing I got the bum end of the deal with the other female intern at my side, I headed down to perform a disimpaction. The nurses had prepared the young woman in the fetal position along with a pair of gloves, some lube and a large disposable cloth for the discarded waste. Without further ado, I lubed up my fingers and dove right in pulling out huge chunks of stool from this woman. Usually, I can overcome these situations by breathing through my mouth. However, in this instance, smell had transcended into taste and I might as well have been licking my fingers for lubrication. My mind began to wander. With each clump of rancid clay stool I added to the pile I grew more demoralized. It was Saturday night, my friends were out partying, and I was literally up to my wrist in shit. Around the 5th or 6th swipe, my FML moment disintegrated into a high-pitched scream of wrong hole that echoed through the unit. I wish I could say I had switched hands before that moment, but alas, my shitty fingers had inadvertently traversed her most sacred orifice. Within seconds my heart was thumping, and my scrubs were soaked in sweat. The rest is somewhat of a blur, but as I recall, after apologizing profusely I had the nurses rig an enema to wash her out. I don't think I looked that intern in the eye again for the rest of the rotation. I can't remember what the patient had been hospitalized with, but I'm sure we both had post-traumatic stress disorder after that. Med student, soon to be intern here. I was on an ER rotation 2 months ago when this gem took place. I'm supposed to do a pelvic on a patient with abnormal vaginal bleeding when I find she only speaks Spanish. I had gone through my routine introducing myself in Spanish and using a translation phone to gather relevant history, but phones just aren't available the whole procedure, obviously. As another poster referenced, typically you warn about pressure on the intrahitus. I did my best, but I didn't know how to tell her to take a deep breath. I apologized for the pressure and thought I was saying thank you for your patience as I cleaned the blood. Apparently I was nervous and was instead repeating, in Spanish, I'm glad I'm doing this over and over again. Yes, the nurse spoke Spanish and enjoyed reminding me about it later. So I'm in medical school and we are learning how to do our very first pelvic exams. A group of 5 or so medical students is in the exam room and there's a volunteer lady in the stirrups and the gyn attending is teaching us how to do it. In the technique he taught us, you put a glove on your right hand and you insert the index plus middle finger in the vagina to palpate. Your left hand, ungloved, is on the patient's lower abdomen. So he's saying aloud, for each us, what we should do. Now put the glove on your right hand. Now put some lubricant on. Now insert 2 fingers into the vagina with the gloved hand. So we are doing it, one after another, and it's getting pretty boring. And then a female medical student in our group is up to bat. The attending says the same things. Now put the glove on your right hand. Now put some lubricant on. Now insert 2 fingers into the vagina with the gloved hand. Then he makes a strangled kind of noise and says, no, the gloved hand. In a nanosecond, all of our eyes zoom in on this lady's crotch, where the female medical student has inserted 2 fingers of her ungloved hand in there. Talk about awkward. Late to the party, but here goes. 3rd year med school internal medicine rotation, was doing a physical on a patient that was a tall and pretty young woman in her late 20s. Go to listen to her lungs, and she's wearing a thick cardigan. Can't hear anything. Ask her to take off her cardigan. She had a collared shirt on under, so that I can proceed with listening to her lungs, and she blurts out, for what? I don't see why you need me to take my sweater off. I got instant chills, not in a good way, as I was alone with her in the exam room. I immediately told her that I'm going to grab a nurse to proceed with this portion of the physical as I wanted her to be as comfortable as possible. I left the room as quickly as possible and went immediately to my attending and told her what happened. She could understand that I was super freaked out at the way the patient reacted and apologized for not sending in a nurse with me. My attending finished the exam and came out and told me that the patient was crazy and that when she entered the room she was crying, which only freaked me out even more. Naturally I freaked out and thought, OMG, she's going to lie and say I did something to her and my future is over. But in reality it turned out she had been sexually assaulted a few weeks prior and was still very uncomfortable with any man touching her. I'm an athletic training student at a small college. first year students aren't allowed to do a lot, so I did everything I could when they let me. One day the swim team got done with practice and came in to get ice. Wrapping ice on athletes is something I was allowed to do, so I hopped to it. Last person getting ice was a extremely attractive girl who wanted ice on her thigh. A very simple task. So I get to wrapping, but instead of taking a knee I squatted down. On the third pass between her legs with the wrap I lost my balance and went face first in her crotch. Having my hands full and being in an awkward stance meant that I was down there for about 5 seconds before I could come up for air. She got red-faced but never said a word. I mumbled sorry as I finished wrapping the ice and she went on her way. I was red from embarrassment for the remainder of the day. Like and subscribe for more Reddit videos.